If you like this video, press the like button and subscribe this channel and press the bell icon to get notification of our new videos. Hello everyone, welcome to mbgs.com. So this is our 7th lecture on Pemphigus, and we had already discussed many topics on dermatology. So if you want to check the playlist, then the link is given in the description below, and also I request you to download the PDF of this notes. The topic is Pemphigus. The link is given in the description below also. So let's begin with this. So today's topic is Pemphigus. Okay, so Pemphigus is a blistering disorder. In the next video we will discuss about bullous pemphigoid. So please subscribe the channel and press the bell icon for that video also. This Pemphigus is immune bullous disorder. That means it is immunological bullous presentation disorder. So antibodies are formed against desmoglein. So there will be intraepidermal bullas. Okay, so we have many types of Pemphigus, but we will discuss only two which are main. So Pamphigus vulgaris and Pemphigus foliaceus. Okay, so as the name suggests, this Pemphigus vulgaris means the most common type. Vulgaris means the most common type. If you find the word vulgaris in any disease, then it will be most common type of disorder. Okay, so the Pemphigus vulgaris is the most common type. So it is associated with HLA-DR4 because it is autoimmune, and Pemphigus foliaceus is associated with myasthenia gravis and thymoma. Okay, so coming to the clinical features. So we have desmogleins, as we had discussed in dermoepidermal junction video. We had discussed that there are many types of desmoglein. We have desmoglein 3, desmoglein 1. So the main role of desmoglein is here. Okay, so we have desmoglein 3 and desmoglein 1. Okay, this desmoglein is present in buccal mucosa. Okay, and this is present in skin. Okay, desmoglein 1 is also involved in Pemphigus vulgaris. Okay, so but the more common type is desmoglein 3 is most common type here in Pemphigus vulgaris, and the most common disorder in the is desmoglein 1 in Pemphigus foliaceus. Now coming to some clinical features about buccal mucosa and the skin involvement. So there will be buccal mucosal erosions will be present. Okay, but there in foliaceus there is no buccal mucosa involvement. Okay, now coming to the skin part. So we have bulla which are flaccid. Okay, bulla which are flaccid, and we have suprabasal split. Okay, now coming to foliaceus part. So there is no buccal mucosa involvement, and we have flaccid subcorneal split. Okay, now coming to some signs that are clinical signs here. So the first sign is Nikolski sign, and another sign is bulla split sign. Okay, so what is Nikolski sign? Suppose this is the skin and we have a bulla present over the skin. Okay, and we apply a tangential pressure over the bulla. Then what happens? This bulla will spread at the adjacent skin. Okay, that means on applying tangential pressure over the lesion, then overlying skin will separate. Okay, now coming to bulla split sign. What is bulla split sign? Suppose this is skin, we have a bulla, and we apply a perpendicular pressure, but not tangential pressure. We apply a perpendicular pressure. On applying the perpendicular pressure, then bulla will spread like this. Okay, bulla will bulge on the opposite side. Okay, so this is bulla split sign. Okay, now these signs are present in both Pamphigus vulgaris as well as Pamphigus foliaceus, but Nikolski sign is more present in Pamphigus vulgaris as compared to Pamphigus foliaceus. Okay, now coming to the investigation part. So acanthocytes are present in both. Row of tombstone appearance are present in both. So what is tombstone appearance? We have, this is stratum basal layer. Okay, these are the arrangement, these are the normal arrangement of the cell. Now what happens due to the split of the skin? Now what happens at the time of bulla formation? These cells are separated from each other because of presence of fluid in the skin. So these resembles like a tombstone. Okay, so on histopath we will get a row of tombstone appearance. Okay, now coming to DIF, which is direct immunofluorescence microscopy. So we will get fishnet appearance. We will get fishnet appearance on DIF, and it is present in both. It is present in both Pamphigus vulgaris as well as foliaceus. But what happens? It is present, IgG are present against desmoglein 3 mainly, and here IgG will be present against desmoglein 1 mainly. Okay, I will show the photograph at the end of the video. Now coming to the treatment part. Okay, so what we will give in the treatment, we can give immunosuppressants because it is a immunological condition, and we can also give biological agents. Okay, so what are the immunosuppressants agents? We can either give steroids, which is dexamethasone. We can also give azathioprine, or cyclophosphamide can also be given. Okay, and in the biological agent we can give rituximab. This rituximab is a anti-CD20. Okay, so this is about the treatment. Now coming to the photographs, some pictures of these conditions. So coming to the first photograph, which is about the fishnet pattern. So this is the DIF microscopy. The DIF microscopy, and as you can see, we can see the net-like pattern, which is like a fish net-like pattern. So this pattern is known as fish net-like appearance on direct immunofluorescence microscopy. Okay, now coming to second photograph. The second photograph is about the bulla. So as you can see, this is a bulla, this is a bulla, this is a bulla, and these are flaccid bullas. Flaccid bullas. So these are flaccid, so it can rupture. So you can also see a erosive part here because these bullas can rupture. Okay, now coming to another one, which is this histology. This, as you can see, we can see a split here in the stratum basal and stratum corneum layer. Okay, this is a split and we have fluid inside it. Okay, now coming to the cells. Look at these cells. Let me change the color. You can see here these cells, because of presence of fluid, you can see a tombstone like pattern, the tombstone like pattern. So this is the tombstone like appearance on the histology. Okay, now coming to another one, you can see the oral ulcer here you can see a oral ulcer. So it is Pamphigus Vulgaris. This bulla got ruptured. Okay, so these are the images of Pamphigus. So this is all for Pamphigus. In the next video we will discuss about bullous pemphigoid. So please subscribe the channel and press the bell icon for notification, and also like this video and share this video with the friends. Thank you.